G'day, everybody. My name is Kat McFerran. I'm Professor Katrina McFerran, more formally, from Australia, as you might be able to tell from my accent. And this video, this teaching video, is an attempt to share with you where I've got to in understanding young people in music therapy, adolescents in music therapy, after 25 or so years of practice and research, and really just thinking deeply about what it is that as a music therapist I might have to offer to young people. And I'm sure that you ask the same question of yourself too. It's not always easy to work with young people who haven't reached a point in their lives necessarily where they're prioritizing giving us feedback about what a terrific job we've done. They're much more focused on surviving whatever challenges they're faced with, which is the reason that they're working with us in music therapy. And you know, we're relatively strange phenomena, a music therapist. Not everybody has heard of us. So the very fact that they've agreed to work with us says a great deal. But I have had the opportunity to investigate, to research, and to do a lot of interviews with young people about their experiences in music therapy. So I do feel a little bit bolstered beyond where I felt as a practitioner, who would never demand that young people fed my ego by giving me useful feedback to make me feel better. That's contradictory to our stance as a therapist. It's not about how we're going in the session. We have supervision to work with that. So I want to share with you some of the things that I've learned that seem really important to me right now about understanding adolescents in music therapy and being a music therapist who works with adolescents. I've just published an article about this recently, and I really, in that article, tried to summarize where I've got to. So I'll use that as the frame for what it is that we're talking about today. So let me just bring that up for you. And the article was published in Music Therapy Perspectives, and I called it Contextualized Recommendations, because that's the key thing I want to share with you about working with adolescents as a music therapist. Oops. And this is my first point, that we can see teenagers and adolescents and young people in lots of different ways, and I'm going to focus on 3 of them. And what I want to say is that we sometimes, if you have a lot of different part-time jobs, might even see literally an adolescent in different places. And when you've had the opportunity to do that, as I have, you suddenly realize that they are seen differently depending on the place where we meet them. So if you meet a young person in a school, you have a particular orientation and a particular intuition, informed intuition, which is set by the context in which you're operating, which is the school context. If you meet them in a youth program, in a community program, then what you're looking at and the words that you're using and the ways that you're thinking about potentially the same young person, just to make it my point, is quite different. Same person, but you'll be looking at them different. You'll be making different suggestions about what you might do. You'll be thinking about different outcomes that might be relevant to them. So you're the same, but your influences are different in different contexts. Similarly, if you met that same young person in an inpatient mental health facility, everybody's looking at them differently in that moment. And yet these young people who are on their own grappling with who am I, and are experiencing all of these different, oh, so I'm sick, oh, so I've got potential, oh, so I need to learn things. In all of these different places, they have to also bring different parts of themselves in order to be seen. And of course, if you have a lot going on in your life, it's hard to be that flexible. So it could be quite confusing, especially if we think about adolescence as a time of what has been called identity making, identity formation in the old school language. So I just want to bring to you that. And this is really my key, this next chart, table is that we actually even use different words, or we should, to describe what we do with young people in all of these different settings. So if we're working in education context, people often describe music therapy as an intervention. But if you were working in a community context, you wouldn't be describing your music therapy as an intervention, but you'd be calling it a music therapy program, or you should, because people don't come to community programs for interventions. The language doesn't sit comfortably with community programs, and I will go into that. Similarly, I don't think that we should talk about all of the adolescents that we meet in music therapy as our clients. I think that's been a tendency in music therapy, which has come from a tradition of psychotherapy and of seeing clients, which is appropriate in some settings to see people as clients. Certainly, if you run a private practice, they are your clients. But I think that when we see young people in an education setting, we see them as students. They are students in that context. If we see them in a mental health context, this word of adolescence, which was the major influence on my use of the term, which is questionable. And I have stuck to it because that's the name of my 2010 book, and so it's recognizably associated with me. But I try to use different language in each of the specific articles that I write, which are about people in particular contexts. But that's developed over time, so you'll see that that's not always true, and I'm just, like everybody else, learning how to do this better. Whereas when we're working in community, we tend to think of young people as youth. That's how we would describe adolescent clients. So I think it's really important that we bring into our conscious awareness the fact that these are really different, that we as music therapists see young people differently, potentially the same young person. And in the paper, I use an example of one person traveling across 3 services. Oh, I hope not too many people have to do that in their lives. That would be tough. But even the focus of therapy, the language that we use for that could be different. In education context, it really is about development, and for us as therapists, about helping people improve in their capacities and their abilities. Whereas in mental health, we might be focused more on reducing unwelcome, unuseful behaviours and ways of seeing oneself and distorted self-image, for example. And in community context, we might be thinking more about voice. So this is just my playing around. But what I'm posing in this table is that we should recognize that we see people, young people, differently depending on where we meet them as music therapists. And therefore, we should think about the language that we use to describe what we are doing together, what we call young people, what we call our own music therapy work, and what we're aspiring towards. So I'm certainly not saying like this is correct in any way. I'm just using a table to kind of illustrate, look at all of these different words we could use to describe the same people. And you can find that in the literature because you'll hear the different words that people naturally use. I've put some of the key authors whose work I've followed at the bottom here, just to give you a sense of other people who also write and research and work with young people as music therapists and researchers. But you'll really hear the different language that comes. And of course, we have different cultural contexts here, from South Africa to Norway to the USA, and of course to Australia, where I come from. And you'll see that there are different research traditions. In community, there is a tendency more towards qualitative investigations because you're interested in voice. And we tend to be more critical when we're working, researching in that space, because we have a heightened awareness of power issues. That's a part of the beliefs and the orientations of working in community contexts. And often a music therapist needs to demonstrate what skills they have so that people can choose whether or not they're going to participate in that program, rather than just saying to people, okay, you need to be in that room at that time. So the ways that we offer service in community context is different than it would be in a school or a hospital, obviously. Then we need to take a social justice orientation, which emphasizes giving voice to people's lived experiences. So there's more of a tendency towards performative practices, which has been named extremely well in the community music therapy discourse. And so it's really important if you've been working in schools and then you go and start working in a community program that you don't just assume that all of that school thinking, ways of talking and doing gets transplanted here, because you'll find that it doesn't sit so easily in that context. But if you are in a school context, then there's a huge emphasis on academic outcomes and improving. That's what schools are for. That's what society has said. Schools, you must create young people who can do certain things by the time they've finished being with you, and we will compare them and rank them based on how well you've taught them. So that's the reality of a school context. And so measurement that's what everybody else in school contexts are living with. So of course, as music therapists, that's what we have to live with as well. Now, in schools, laboratory style experiments seem irrelevant because there's so many uncontrolled variables as to make it ridiculous. And most educators, as well as music therapists, understand that. In addition to that, music therapists often don't work in mainstream schools, although sometimes we do. But we often work in alternative school contexts as well, whether it's special education, as it's sometimes called, for people who have disabilities and are outside of the mainstream school space, or for people who don't fit into schools because of behavioural and psychological and other challenges that they face. But definitely in school context, there does tend to be this kind of social focus. It's a space where you might see somebody individually, for sure, but it's really a place where people's relationships are very primary. And many adolescents who go to school and who aren't facing any particular challenges will also describe school that way. They half the time don't even see school as important for learning. They will see it more as a space where they can actually catch up with their friends. So this social emphasis is really powerful. And often as therapists, we take this lens, which is that emotional well-being supports scholarly achievement, academic achievement. And so we'll often work with a focus on emotional well-being. And in my experience, looking at the work of some of these scholars who have done a lot of work in education spaces, songs play a really important role because it's located in society, and therefore youth music is a really critical part of what music therapists tend to emphasize in educational contexts. And then the third context, which I've selected as being really commonplace where music therapists work with youth, is mental health. And mental health contexts are often, but not always, dominated by medical models in terms of research, where there is a requirement that you can show that this was more effective than this, a comparative kind of a structure, and where you often are tortured by trying to understand how is it the music or the therapist, because they're considered to be separate, whereas as music therapists we consider ourselves to be intertwined, and we can't pull apart what's the music and what's the therapist. But that's the emphasis in those kinds of studies. So there is a push towards that, although qualitative studies which kind of work very clearly and empirically with data analysis are also acceptable often. And in mental health contexts, people are often in crisis. And so there is a focus on the problems that young people are experiencing and trying to develop that sense of self-awareness for them so that they can learn to grapple and to identify the resources that they have to maintain a life, to recover in the true sense of the word, to come to know oneself and to be able to work with one's strengths and limitations in the world. And also, in that context, there's a huge emphasis on emotions, on emotional work, and depression and distress have been really primary in the music therapy research and practice in this field because music and emotions go so well together. And there's evidence to show that music therapy is helpful in working with people who have depression. So this emotional work seems to be very primary. And there's a lot of work with the unconscious in some countries. In other countries, it's more about managing the behaviours and the externalisation of mental health conditions. But as a result of that, it's often illuminating work about revealing that which is unconscious and bringing it into consciousness, whether or not it's historical issues and associations and traumatic experiences, or whether it's actually about understanding why you behave like you do so that you can change your behavior, a more cognitive behavioral approach. In any case, there is this emphasis on developing self-understanding in order to support recovery. And there's been a lot of beautiful work in that area as well. So thinking about young people that we meet as and just acknowledging that we don't meet them in a pure sense, we meet people in context. Then I just had a couple of recommendations I wanted to share with the community, with the music therapy community, about how we might be conceiving our practice with young people. And the first thing I wanted to say, it's probably obvious to many of you, but where an evidence-based orientation is appropriate in some contexts, it's not in others. So there shouldn't be an assumption that it is always the dominant view, which you do see sometimes, people just assuming that we have to have evidence. Evidence is only valued in some contexts, and it would serve us well to recognize where it's valued and where it's not, and then to make choices about whether or not we will comply with that orientation to understanding whether or not music therapy is valuable. I think there's a huge amount to learn. I hope that we do continue to seek understanding of each individual that we meet in context. There's been a huge focus on case studies in the music therapy literature, and I've learned a great deal from reading case studies, especially in my early practice, just being able to see what people do and think about why they do it. And so I hope that we continue to seek deep and rich understanding in that way, because there's still a lot that we don't understand. I want to emphasize and underline that we should never underestimate how important positive experiences are to young people. They just want to feel better. They just want to be happy, just like the rest of us, but they haven't got that life experience which tells them that you come out of this, that life goes up and down, and that when you survive the downs, you can look back and go, wow, I survived. So really the importance of having positive experiences, and that music affords positive experiences as well as deep emotional work and all of the other things that we can do. I've not yet met a young person who just doesn't want to be happy. And so for some people, a moment of happiness is really critical. For others, it's working towards a more sustainable way of being, which will lead to happiness. I think that there has been a tendency, and I'm in this too, about focusing too much on music therapist perspectives. I think we really need to gather much more from young people about what they want to do with music therapy, to be more collaborative, to be listening and responding much more. In our research so far, we have focused a lot on what we think. I think it's time we can go further. And the final point that I wanted to make was that group music therapy and individual music therapy with teenagers are such incredibly different worlds. So sometimes I think when people conduct research in group music therapy, they're looking for unachievable outcomes that you would have to be focused on in individual therapy to possibly achieve, improve self-esteem in a group. Groups are a social microcosm of the world. There's so much going on in a group, in music therapy, so many millions of layers going on, that for one person to have a measurable individual outcome from that just seems to be out of context with what we're really trying to do. If we choose to run groups, we're focusing on the relationships and the social encounters and the ways that people perform their identity in group contexts. And it's not about individual achievements. They will be very dispersed and unique to each individual in the group, different outcomes. So I think that we need to be careful that if we're doing research in this space, that we need to think, in what are we actually looking to achieve with groups, and what would we need an individual music therapy process to achieve? And similarly, when we're setting up practices as music therapists, that we need to really think about, would this be best served in a group or with an individual? And I'm a great believer in music therapy groups. They are challenging, they are hard work to run. You often don't know what's going on or why that just happened, and we're developing a literature to explain that. But I think music therapy groups are just the most fantastic opportunity for young people, and I really, really believe in their value. Obviously, individual work allows you to go deeper and to be more specifically targeted on that one young person's particular need in that moment. But then we really have to think about, how does this go beyond our individual relationship to benefit the individual that we're working with? So there's a lot more work about how that goes any further. But just remembering that group and individual work is so different, particularly with teenagers who are absolutely focused on the social context in which they live. So that's what I think currently about working with teenagers in context. It's really different from the four theoretical orientations that I mapped out in my 2010 book. And I really want to acknowledge that that's one perspective. And this is a really different one. And I've really tried to ground it in all of the work that music therapy scholars have done around the world, and to name that in the article. But if there's one takeaway, it would be, please think about each person that you meet in context, not just as the gorgeous individual that they are, but the ways that your context is framing how you see them, and that that's absolutely okay and necessary, that it's just acknowledging that, so that you practice and you describe your practice and you offer opportunities in ways that are the most helpful to the young people with whom we work. Thanks very much. If this was of interest to you, I'm really glad. And if you are interested in working with young people, then I'm basically thrilled about that. Music therapy and adolescence is a fantastic field. Thank you.